Many don't know this, but the US government and US taxpayers specifically spend millions of dollars, in some cases tens of millions of dollars, in helping with the research and development of pharmaceutical drugs. In the case of a drug that helps to prevent HIV, the federal government and US taxpayers spend about $50 million in research and development. Now, Gilead is the pharmaceutical company that developed this drug, and the United States government actually has the patent for this drug. But guess what? Gilead has been selling the drug, has been profiting from the drug, and the United States government, even though it has the patent, has not profited at all. They have not collected a single penny. According to the Washington Post, the US government patented the treatment in 2015 and is not receiving a penny for the use of the drug from Gilead Sciences. So the drug's name is Truvada, and it earned $3 billion in Truvada sales last year alone. So first of all, there's the profit component of this story, but I would argue more importantly, there's the issue of keeping Americans healthy and safe, because again, this has been proven to prevent HIV. So Gilead, which enjoys a US monopoly on Truvada, charges between $1,600 and $2,000 for a month's supply of a pill that can be manufactured for a fraction of that amount. The number of new HIV infections in the US has barely budged, meanwhile, and is stuck at around 40,000 a year.
So get a load of this. Not only did they get the patent from us, then they get a monopoly for it. Wait, why do you have a monopoly? That doesn't make any sense at all. Because the logic of giving drug companies monopolies was, well, look, they did so much research and development and they had so many expenses, so they've got to be able to earn those expenses back. If they immediately had to compete and people could copy their drugs, nobody would put the money into research and development. Except in this case, we put the money into research and development. Well, then shouldn't we get the profits? And so look, if we had a reasonable conclusion here, and there's two ways to have this be reasonable, the government and Gilead could have worked together. And so Gilead did chip in a little bit. They did one of the experiments, and in the beginning gave some of it away for free as they were doing the experiments. But I mean, it is a tiny part of it. Actually, a bigger part was the Bill and Melinda Gates Foundation that put in 17 million. So the US government was the most important, Bill and Melinda Gates second, and Gilead, this company, was at best third most important. But did the foundation or the government get any profits? No. You know how much Gilead made since 2004 on this one drug? $36.2 billion.
Yeah.
Now on top, but now the insult to injury is we don't get any of those profits. And we already, all of us paid for making the drug in the first place. Then they charge us exorbitant fees, as Anna pointed out.
Right.
And then your life's in danger if you can't afford it. And they're like, who cares? I'm maximizing profit off of your back.
And by the way, I want to clarify one thing, Cenk, because Gilead does not have the patent for it. The CDC has the patent for it. So here's the issue. We have the patent, right? Which means that we should be able to share the profits, but more importantly, get this drug at a much lower price. But the CDC is not fighting Gilead. Gilead's like, no, this patent is not credible, has no merit, it's invalid. They refer to it as invalid. And the CDC won't fight them on it. They won't fight them. The Trump administration keeps arguing, no, we're the best, we're gonna lower drug prices, we're gonna look out for the American consumer, we're gonna improve healthcare. No, they're not. They won't even fight on something where they have the legal grounds to put the fight up and get the actual profits and the drug at a lower price. They don't care. Trump doesn't care, the CDC doesn't care, they don't wanna fight this.
This is a groundbreaking drug that will absolutely save lives. And we would not know that just think about it, right? It's 2019 and there is a pill that helps prevent a person from contracting HIV. That's a thing.
Yep.
And we would not have known about this without the $50 million in taxpayer money that was put into these tests to figure out that this drug that was already on the market for something else could work for this. We would not know about this. So it's not even about necessarily wanting the government to profit. Just pay taxpayers back in the form of making sure that everyone who should be taking this is allowed to.
Yeah.
Because right now, it's their estimate in 2016 was less than 10% of the 1.1 million people who should be on PrEP, and that's what it's referred to, Truvada, it's PrEP. The treatment were receiving the drug, and of course Gilead comes in and it's like, no, we improved that to 20%. But the thing is,
how about 100%?
Exactly.
Right, because these are human lives we're talking about. And in Virginia, Medicaid says it pays $54.04 a pill, or $16.21 a month.
Yeah.
More than $1,500 a month. And that money could be going to all kinds of different, other different parts of, HIV and AIDS awareness and education and distribution.
Yes.
Not paying $1,600 a month for treatment.
So you can do one of two things, or you could do both. I would argue you should do both. You should take a part of the profits, and you should say us giving you this patent comes with strings. One of the strings is you cannot overcharge for the drug, because we spent taxpayer money so that it would have advantages for the taxpayers, not just so that you could take all the profits home.
Yes.
I mean, this is a spectacular case of privatizing the gains and socializing the costs.
Yes.
So we paid for the drug twice. Once when we did the research, and now we're paying exorbitant prices for the people who need it. And they took home $36 billion. This is not how capitalism is supposed to work, or democracy. Two easy ways to follow the Young Turks. One is hit the subscribe button down below, then you're a TYT subscriber. And second is ring the bell. And when you do that on YouTube, you're notified of our videos.